I'm going to switch attention to Lindsay Porter, who will be giving our first talk on colonial influences on medicine. Dr. Porter comes with a French and art history degree, an MA in 18th century studies, and a PhD in history from York. Her books have been published in several languages, and her latest book, Popular Rumour in Revolutionary Paris, there might be some tips there, was published earlier this year. She has spoken at the Oxford Literature Festival and was shortlisted for the AHRC BBC Radio 3 New Generation of Thinkers scheme. And just an interesting tip, that she first became interested in the cultural legacy of the Tuskegee. Is that pronounced correctly? Tuskegee. Thank you. I have wondered for years how to pronounce that. Now I know. The Tuskegee syphilis experiment when contributing to an encyclopedia of conspiracy theories in US history. And with that, I shall hand you over.
Thank you. Well, thank you very much. Can you hear? Thank you very much for inviting me here. This is, I think, as Zamali said, this is a very timely event. And also for me, coming from the humanities, we often aspire to these interdisciplinary events. This is quite the most interdisciplinary occasion I've ever been at. I think when I've normally been in a hospital surrounded by medical professionals, it's been for entirely different reasons. So I'm quite pleased to be able to sort of, share these cross-cultural ideas. So as we were saying earlier, questions about decolonising and decolonisation are being raised across all disciplines, and particularly in the humanities. There was an event last month at the Wellcome Institute that was talking about decolonising its historical collection. And it addressed how it might represent its collections while acknowledging its own privileged history as a site of collecting. This is a concern of many museums and galleries and in the humanities generally. And what they all share is an awareness of the need to question and challenge traditional narratives and power imbalances, and looking to disrupt the white patriarchal status quo. There was about a couple of months back, Manchester Art Gallery, that I do a lot of public engagement events with, was an absolute media storm when it took down one of its most popular paintings, which is a Victorian painting of Hylas and the Nymphs, which comes with a very kind of loaded Victorian male narrative. And it wasn't entirely, its intent was not entirely understood. So it's a very emotive subject, I think. So in history, this often involves reassessing past legacies, decolonisation, and reconsidering or reframing who and what we honour and how we commemorate. Now, this is a piece by the 2017's Turner Prize-winning artist Lubena Himid. It's called Swallow Hard, and it's part of a much larger piece called The Lancaster Dinner Service. And her work, to me, offers a very direct visual representation of this type of decolonisation. So the Lancaster Dinner Service of 2007 was part of a larger installation which acknowledged the contribution of the unnamed, unslaved people responsible for the goods in prosperous 18th century houses. So the mahogany furniture, the textiles, and the sugar on the table. And this piece is one out of a 100-piece china service, which takes the blue and white china that was so popular in the 18th century and superimposes images connected with the slave trade. And she says of her work, "I tend to address the hidden and the neglected cultural and economic contribution made by real but forgotten people to the history and swagger of so-called great and established nations." And I love that. I think that this addressing of the unnamed, of the hidden and forgotten, is very much what creates this sense of swagger in nations, but it's something that gets overlooked. And I think decolonisation, particularly in the humanities, its job is to reassess these national narratives. So, one of the questions raised at the Wellcome event was how this theoretical reframing could be applied in any practical sense. We're thinking, well, they have a collection which is predicated, like many collections in this country, on an imperial past. So how do we then acknowledge this, how do we present it, and how do we move forward? And one of the questions that arose, which was a very interesting one at the welcome, was, you humanities people, you're all talking theoretically, but what is practically, what is a practical move to make? And this is something which is even more relevant to medical teaching, because we're not talking about the theoretical, we're talking about the absolutely hands-on practical. So this afternoon, I would like to look at how the 18th century European Enlightenment and subsequent professionalization of medical practice encouraged a school of scientific inquiry which privileged experimentation and discovery at the expense of empathy, one which over centuries rewarded and lionized the European male practitioner and created a culture which at its most extreme encouraged the doctor to see his patient as a subject first and a human second. So the 17th and 18th century Europe, the period that we know as the Enlightenment, saw a flourishing of work in the arts, literature, sciences, and philosophies. Its most radical shift in human thinking came in its questioning of arbitrary power, particularly that of the Christian church and of the absolute monarch. And the centrality of, it questioned also the centrality of religious faith in all human endeavour. So the momentousness of this shift can't be overstated. Philosophers no longer looked to God for direction, but they posed their own set of questions about how to live morally, ethically, and usefully, and what it means to be human. And the answers, they concluded, depended on individual agency, the human intellect, and close observation of nature and the cosmos. And this is a philosophy, therefore, that favoured reason over what was perceived as superstition. So with this came the professionalization of the practice of medicine and medical training. And now, just as an aside, I don't want to suggest in any way that expertise, I'm not a kind of Michael Gove, no one trusts experts. I love experts and I count on experts. What I wanted to suggest is, with this kind of grounding in the European Enlightenment, in establishing a set of measurable criteria, this medical training would go on to exclude certain practitioners, entrench hierarchies, and favour and reward a set of behaviours that set medical practice and healing in Europe on a particular path, the results of which we're seeing today. So prior to the 18th century, healing in healthcare was very much a more ad hoc arrangement. Childbirth was attended by local women, folk remedies provided cures for ailments, and the church provided hospital care. The renowned medical historian Roy Porter, who's absolutely no relation to me, but he noticed in Samuel Pepys' diary in the 17th century that of the nearly 490 times Pepys refers to his health, only about 40 times does he seek outside advice, and only half of that from physicians. So this isn't to say that he couldn't afford a physician, but it was just one of the many options that one might have at one's disposal. And during the 18th century, this begins to change. The practice of medicine becomes more respectable and professionalized, and it also became divided by social and economic class. So the hierarchy of healing, if you like, and caregivers was established, with at the top of the profession, the university-trained physicians. But universities at that time were only open to women, and it was only Anglicans who were able to study medicine. So already we're kind of picking an elite and excluding certain people from certain backgrounds, and therefore also setting one on a path that is dismissing of these other avenues of care. So with the physician is really the apex of the profession, and many satirical images of the physician during this period allude to the material benefits that a physician gained from pandering, I suppose, to his patients. So these are a selection of images from the 17th to the 19th centuries. The one on the top left is actually a kind of 17th century satire of an apothecary, and he's a little monkey, and monkeys in the 17th century are representing foolishness, they're also representing licentiousness, and his little kind of enema he's holding in his hand is a kind of reference to what was felt to be an overabundance of use of enemas with young ladies. The one next to it and the one below are really playing with the idea of the material benefits that a physician gains. So the two at the top, they're both attending to a very wealthy hypochondriac, and they're clearly just saying whatever he needs to hear to keep being able to bill him. The one at the bottom is very interesting and actually has all the things to do with anti-French sentiment. Our very, very fat and prosperous physician is thanking the French chef in the stately home because it's his food which is giving him his clients. And that was made in 1815, so that's actually a little dig about Napoleon. And then the 19th century one are two physicians, one saying, this was published in Punch, a satirical magazine, he said, oh, I ordered an ice cold bath for him. And the other said, but he has influenza. And he said, I know, but this will give him a pneumonia, and that's my speciality. So this is, if you like, there's already a kind of, there is a popular view of what a physician can offer, which is something I'm a great fan in the popular view. Whether it's accurate or not, it's something that one needs to address. So these are what these are all related to. So as professional medical training and practice became more exclusive, it arguably began to privilege the pursuit of knowledge at the expense of emotional or cultural sensitivities, propelled by this Enlightenment ideology of rationalism over superstition. And I think a prime example of this is illustrated by the abhorrence with which the public contemplated the practice of dissection. Now, in many cultures, dissection was seen as an act of desecration, and one of such unspeakable inhumanity. It was enacted only upon enemies in warfare or convicted criminals. People felt come Judgment Day, if their body was not whole, they could not stand before God. So if you are deconstructing a corpse, you have done the ultimate in dehumanization and annihilation. And that's something that's important to kind of bear in mind, because this is, again, something that's culturally at odds, science which is culturally at odds with emotional, a kind of emotional response. So, however, the importance of dissection in terms of the knowledge of anatomy, it can't go, is obvious. And by the 16th century in England, dissection was recognized as essential to furthering knowledge of anatomy. So the Company of Barber surgeons were permitted the bodies of 4 malefactors, these would be criminals, a year, which was considered such an appalling act that it was added on to one's sentence of execution as a further punishment, if you like. And criminals were publicly dissected as a deterrent to others. Now this is 18th century Hogarth, a great 18th century engraver and satirist. This is the fourth in a series called The 4 Stages of Cruelty, and this is the last stage, if you like. And the very first one follows a little boy who's seen abusing an animal, and this is, if you like, sets him on his path of criminal kind of cruelty. He ends up committing murder, and his final stage is to be, after being kind of cut down from Tyburn gibbet, he is now being publicly dissected. And it's kind of shown in all its goriness, but also in its kind of what a degrading spectacle it is. So there's a dog down at the bottom who's eating his heart or organ, liver. What I found very interesting is the figure at the back, who does look very much like a judge sitting in judgment. He's actually the chief surgeon. So there's an interesting kind of correlation between kind of judgment and science, and all of these onlookers in this kind of scrum, which anyone, I think, would not really want to think that was what happened to their remains or ones of their loved ones. So we can't doubt the importance of dissection in the advance of medical knowledge, and yet during the 19th century, such practices seem to indicate a cultural arrogance which encouraged the medical practitioner to pursue his investigations at the expense of public morality and codes of behaviour. And such anxieties were expressed in literary works, such as Mary Shelley's Frankenstein, which is a philosophical treatise on the moral limits, really, of scientific inquiry. 70 years later, Robert Louis Stevenson was said to have drawn inspiration from Surgeon John Hunter for Dr. Jekyll and Mr. Hyde. So the the 18th century, I realise that formatting of these are much wider than they should be in real life. If you look at them, these are from the Wellcome collection, and they're slightly more spelt. Anyway, the 18th century also saw botanist Carl Linnaeus develop his scientific method of classification known as taxonomy. And this compulsion to categorize and collect was not exclusive to the scientific community. It was part of a larger cultural preoccupation which sought to own, to display, and to impose order on the natural world. But this mania, if you like, for categorization encouraged pseudosciences such as phrenology, in which the shape and size of the head was said to convey character traits. Now, at its most pernicious, it was used to categorize degrees of mental deficiency or disturbance and to prove, allegedly, racial distinction and alleged inferiorities, thus contributing to the practice of eugenics. So UCL's own Galton collection is it has a record of this legacy, which I think is probably going to be talked about later, so I won't really address that. But this is an image then of the Franz Joseph Gall, who developed this theory of phrenology. And this is by a great 19th century satirist, Thomas Rowlandson, who I think is already kind of questioning the legitimacy of the practice. The very top row has, as a category, lawyers, thieves, and murderers. And I don't think it's any coincidence either that his colleagues around him all had these very peculiarly shaped skulls. So I think he's sort of playing with the absurdity of the practice of phrenology. Another significant component in the process of decolonization comprises commemoration. Who and what it is we commemorate, how and why, and objects of commemoration such as statues, plaques, and buildings distill and embed particular narratives, which, unless we choose to readdress them, can perpetuate historical injustices and untruths. Human endeavour or achievement is often embodied by the representation of the individual, who simultaneously symbolises the endeavour and is represented as solely responsible for it. So in the case of medical history, it entirely overlooks and negates the presence of the patient. And Roy Porter, again, medical historian, was saying, the medical histories up until he was writing, it was about 2005, are very top down. They very come down from the perspective of the physician and the practitioners, and that there is a history to be written from bottom up, which would be from the point of view of the patients. So the doctor is individualized, the patient, if referred to at all, is an anonymous series of symptoms. So this absence in the historical record and the need for a reassessment of the accepted commemorative narrative is exemplified in the story of James Marion Sims, which Amali referred to earlier, and this is actually could not be more timely. This up until yesterday, this was standing outside Central Park on Fifth Avenue, and if you look on social media, you can see it being taken down. So Sims has been described as the father of gynecology, responsible for devising the speculum and with developing a technique to repair the debilitating condition of vesicovaginal fistula. One of several memorials to Sims, and this has been taken down, but it has not been destroyed, it's actually been moved. So it was, up until yesterday, on the perimeter of Central Park. On it reads, surgeon and philanthropist, founder of the Women's Hospital, his brilliant achievement carried the fame of American surgery throughout the world. And plaques in his home state of Alabama describe him as treating empresses and slaves alike. So in recent years, these memorials have been sites of protest, calling attention to the historical reality that such tidy summaries obscure. Sims had a clinic in Montgomery, Alabama in the mid-19th century, and he worked as a plantation doctor, where he worked under two prevailing ideologies, both of which served to dehumanize and infantilize his subjects, and both of which are crucial in understanding his subsequent series of experiments. So the first was the belief that enslaved people were both morally and physically inferior, and thus deserving of illness because of moral laxity, lack of hygiene, or lack of intellectual capacity to follow treatment. And the other was that they could be treated differently because of an alleged higher pain threshold. And the second to remember is that legally his subjects had no autonomy. They could not give or withhold consent. As a plantation doctor, Sims was working for and being paid by the plantation owner. Hence, his healing was motivated by a need to repair rather than to heal, really with an economic purpose to get people back out able to work. Really the ultimate in the dehumanization of the patient. In June 1845, a 17-year-old woman known to history only as Anarcha laboured for 3 days before Sims arrived to deliver her baby with forceps, with which he admitted he had little experience. The baby died, and Anarcha subsequently suffered damage to her vagina, now known as vescovaginal fistula. Many women of all ethnicities and social classes suffered this complaint after a difficult childbirth, but the high incidences among the enslaved population at the time was initially blamed on what medical historian Harriet Washington perceived as the ignorance of plantation midwives. Now, obviously, they were not ignorant, but this is again a kind of white male patriarchy saying, well, they're suffering this because of the care that they're getting. Sims himself later admitted that the higher correlation of the condition came with forceps birth. And so this is an example of something that, Amalie, I think you've referred to, where you have the deleterious consequences of technological intervention into the birthing practice, and also an overriding of traditional and indigenous knowledge. So coming in, with a sort of cat-handed forceps and actually causing irreparable damage. Sims recognized he could make his name and his fortune if he could cure the condition. But he also knew it was utterly impossible for him to do experimental surgeries on white women. So he was essentially reliant on the system of slavery to access his subjects. Enslaved people did not have to be recruited, they did not have to be convinced, and they did not need their consent. So this is a mid-20th century artist's impression, part of the History of Medicine series, and it's called J. Marion Sims, gynecological surgeon, and it is absolutely doing one of those kind of, series of great men, great events in history, which is very much cleansed and made anodyne, actually a very brutal reality. It's not an entire fiction. It correctly references that the young woman subject would be alone, outnumbered by standing, dressed, white male medics. And it illustrates in that respect, I think, the dominance of man over woman, white over black, educated over uneducated, and are all contributing to a discourse of a kind of doctor-patient imbalance. Yet this is a celebration. It's intended as a celebration and a commemoration of science and scientific endeavour, and Anarcha, if it is indeed Anarcha, and her unnamed sisters kind of peering round the corner, are apparently the willing sacrifices to scientific experiment. The women treated by Sims were afforded no such dignity. The modestly dressed young woman depicted in the illustration was instead naked on all fours, surrounded by other physicians, apprentices, and curious prominent local citizens with no medical background but just coming to have a gawp, gathering as though to inspect a scientific specimen or an exotic species. The surgery and experimentation was both excruciatingly painful, performed without anaesthetic, and needlessly degrading, ignoring the basic dignity and humanity of the sufferers. Over the next 5 years, 10 enslaved women, only 3 of whose name are recorded in history, so that is Anarcha, Lucy, and Betsy, had scores of operations. Anarcha had 30 alone. The findings were published in 1852, which made Sims's reputation. He then left Alabama and went north to New York, where his subsequent writings obscured the fact of the ethnicity of his subjects, and that was not out of any sense to sort of conceal their identity, but at the time it was felt, as I said, that if enslaved people had higher pain thresholds, that any surgery that he might have enacted could not possibly work on a white woman, and that it might have invalidated his results. So the whole thing is just a very unpleasant enmeshment of racism. So, in recent years, his statue has been the site of protest. And up until yesterday, I was going to say there are moves to move it to Greenwood Park Cemetery, where he's buried, but it in fact has been moved. And it's an interesting one because there are some people saying, well, he is an historical fact, and why should we be moving this? And one needs to constantly readdress history and just question what that narrative is. So we're not saying that he did not develop techniques to cure, but we need to reveal and uncover and address the institution and the institutionalized racism that allowed him to do so. This is talking about the 19th century, but we'll get to the 20th century. And in 1932, the US, in Macon County, Alabama, saw what became known as the Tuskegee syphilis experiment. It continued for 40 years until a whistleblower drew the nation's attention to the extent of the deceit. And this, I know, is something that is addressed in terms of medical ethics, because this is actually an alleged letter of consent. Essentially, the study was predicated on the belief that syphilis manifested itself differently in different races. And it aimed to show this by studying the progression of the disease in 600 black men. In Macon County, Alabama, was grindingly poor, and a lot of the health issues were really social and due to poverty. And a lot of the syphilis was congenital, and it wasn't due to any kind of licentiousness or anything that kind of fed into narratives about particular types of behaviors. So the men who were recruited were promised free medical care for partaking in the study. In reality, there was no medical care. They were intentionally denied treatment. They were subject instead to painful and irrelevant interventions such as spinal taps. And when they died, they were autopsied in a final attempt to legitimize the belief that there was a racial component to the disease. Even when antibiotics were discovered as a treatment in 1943, that was withheld. And the people who had organized this experiment were even able to keep men from being drafted into the army for fear that if they were in the army, they would receive treatment and thus invalidate the study. So it was not until this letter, if you like, inviting people, is saying that you were getting treatment for bad blood. So bad blood covered a range of illnesses, but it was also a sort of euphemism for syphilis. And you're being invited back for special treatment. And so this is suggesting that you will be given some sort of cure. In fact, this special examination and treatment that you must meet were actually spinal taps. And if one has ever had a spinal tap, you really wouldn't undergo that for no reason. So, by 1955, nearly a third of autopsied men had died directly of syphilis. Many survivors suffered the deadliest complications. 40 wives were infected. 19 children were born with syphilitic defects. In 1958, 25 years after the study had begun, participants were given the certificate and $25, $1 for every year of the study. So the breaking of the story in 1969 led to an investigation, unfortunately not till 1972, ending the study. Families were awarded a $10 million out-of-court settlement, but it wasn't until 1993 that subjects and their families received an official apology from the US government, from President Bill Clinton. So these are both US examples, but their legacies and the lessons that can be learnt are not exclusive to the US. In this talk, I wanted to show how the roots of the European Enlightenment contribute to a particular mode of scientific inquiry, one that encouraged rationalism and objectivity over emotion and empathy. This is in itself a kind of colonization, as historian David Arnold describes in his book on colonial medical practices in India. And I think this is a really interesting quotation. I will allow you to read it rather than waste time reading it myself. Anyway, I would hate to conclude on a note of pessimism or even accusation. Many of the issues referred to about consent, about medical trials, and about patient welfare are addressed here at UCL with its model of patient-centered care. The United Nations' new Sustainable Development Goals are all now human rights based, with an emphasis on dignity and healthcare rather than simply access. The Berwick Report 2013 highlighted the centrality of compassion in healthcare, while the 2015 legal ruling Montgomery versus Lanarkshire recognises the autonomy of the patient in establishing its criteria for informed consent. So events such as this one here today are intended to encourage the continuation of such ethoses, to raise questions and encourage discussion leading to ever improving care. Thank you very much.
I was just curious, as a historian, what you think about this decision to not destroy historic monuments like Sims, but rather to relocate them or put them in museums. This just recently happened with the post-Donald Trump controversy of the Confederate statues, as well as with Sims going to the cemetery, I believe.
Yes, it's a terrifically interesting and troublesome question, because I think that it's not. I don't think there's one size fits all answer to that. And Sims, for example, if one wants to recognise his contribution, one feels like there needs to be a larger context. And so where that statue is moving is to where he's buried, in which case, there are all kinds of commemorations to people. And that perhaps is a more, a less, it's offering less judgment on his importance if it's in a cemetery rather than opposite a medical. It was opposite a medical academy, I think, and right there on Fifth Avenue outside Times Square. It was also kind of in East Harlem, so it was very just not the place, and subsequent removal of that. There've been some calls to have a memorial to the mothers of gynecology, to Lucy, Anarka and Betsy, and to their unnamed sisters. And so that's kind of addressing that question. The question of Confederate generals, personally, hand on heart, I could not find any justification for having memorials to those generals. And it's not erasing history, because that's nonsensical. We don't have a visual representation of every single person or aspect of history. Who we choose to commemorate reflects our values. And so Confederate things, there's no justification whatsoever, personally.
Oh, sorry. A question, a comment and a question.
Yes.
I'm very inspired by what you're saying about memorials, and I've been trying to do something to memorialise the mothers of IVF, the hundreds, if not thousands, of women who were experimented on with promised things that were not available, like being the first person to be pregnant, maybe covering up the second IVF baby that died thanks to the amniocentesis the doctors insisted on, and no memorial whatsoever, barring the Nobel Prize for the Great Man. As a historian, would you be concerned that the history is being written by scientists going and doing transcripts with non-open-ended questions, and a Cambridge College having total control of the archives? So that's
So I can say about that. Well, I would say that history is a wider discipline. So it doesn't matter what the official story is. Someone will find a way of circumnavigating that narrative and representing it, I think.
But while we have a small group of women who are silenced, stigmatised, shamed, hurt by their experiences, who are in their 70s and 80s, but nobody can contact them because it's confidential. There is an opportunity now to speak to the women as well, but we never talk about them, and we have blue plaques to the men.
Right.
And
Yes.
the one who got lucky,
Yeah.
and the daughter who did nothing but be in a petri dish, get large fees for writing books and going to IVF conferences.
Well, I mean, I think, you know, this is actually what you're addressing is very much, I think, what decolonisation in the largest sense is. You know, it's already addressing this fact that actually, you know, this is, contributions are made from all sources, from all directions. I don't personally know what the things I look at are so old that there is no confidentiality.
Yeah.
I don't know then, you know, how that works, but that feels like something that is very important to address, you know.
So should I be writing to the obstetric and gynae magazines, or where should I be raising concerns now, academically?
Would you know where to know?
I don't think any of this road is paved for us.
Yeah.
I think
Is it
we've
good?
just got to, you know, use what seems to be right at the moment and what movements are happening at the moment. But certainly decolonisation isn't just, you know, being racial, it's women were subjugated, disabled were subjugated, you know, LGBT were subjugated. So we're playing a new part. I can't give you
Yes, but I think it's you know, it's an important one to address, I think. Yeah.
I chip in with distinguishing, as a Coleman historian, but also still part-time, I would draw a distinction between historians who practice and it's their role, and people who write history of science. Because if the scientists write it, we tend to get hero narratives. Whereas if people like you get hold of it, we get the wider narrative. So I guess if can we reframe the question as how do the historians get it from the people whose field it comes from?
You know, but I mean, historians also have their own agendas and ideologies as well. You know, so
Perhaps you are right, because I think that the matter is another one, because not all history is written also by women, but science is not made by women in the sense of the feminine sense of the word, because as David Noble says, women were out of the history from after the Christian era, after Romanic era.
yes.
Because you remember that there was the first, it was an Italian professor, Trottola de Ruggero, that was the first European obstetrician and gynecologist that wrote a manual that went on till the 16th century in Europe. It was made by a woman that taught at Salerno University, and her work was the main manual in Europe. And she worked and wrote as a woman. After that period, there was no more a woman, because women were out of science, of STEMs and obviously medicine. So that now, for some decades, we are trying very with a great difficulty to have in universities, in schools, in hospitals, women that think medicine and practice medicine as a woman.
Right.
Because otherwise we can't write
Yes.
medicine.
Yes.
And we can't write manuals, and I thank a lot Suzanne for her manual or other, but there is not a mainstream, not yet a mainstream.
No, not
And
at all.
also Amali that is.
We only have 1 minute left. Can I speed you up?
Yeah, no, you're absolutely right. You're absolutely right that there is a dearth of examples of individual women being trailblazers, and that's kind of across disciplines.
Yes, out of the great history
Exactly.
and the great science.
Exactly. You know, I began as an art historian, and so that question of why women are great women artists, you know, is first of all balderdash, but because it's not been chosen to be remembered, you know.
Yes.
So this is all very, you know, fruitful and a new, you know.
One more quick one. Did we chance to follow, or shall we move gracefully to the next topic? Go on.
Do you think we should move away from statues of individual great people, in inverted commas, and maybe acknowledge a little bit more all of the people anyway, generally, who
Yes.
see?
Yeah, no, I think, yeah, and I think there's again, I'm trying to be quick, in Manchester, disgracefully, there is no statue to Emily Pankhurst. And so there was a commission, a kind of competition, and people came up with various designs, and you know, most of them kind of Emily, but one of them made a point of having, she has a cloak, and attached to her cloak, I think they're like keys. I feel like it was a key that was a symbol of the suffrage movement, and those were all the individual people. So it could have perhaps been more collective, you know, because it is still pinning on an individual. But you're absolutely right, and I think, you know, that sites of, there's a whole load of historians who look at sites of memory and how we commemorate. But perhaps that kind of 19th century man in his frock coat with a pigeon on his head is in the past, you know. So.
On that note, acknowledgement one more time, please.